Good morning to everyone. We're going to go ahead and get started here in just a moment, but I just want to take a moment, make sure that everybody's tech is working. You can hear us. In the meantime, continue to drop in your messages in the chat as you continue to do that. And if you haven't yet already, complete the poll. I'll be closing that in just a short second. And Chas, we'll turn it over to you here in just a second. And here are the results of how everybody's doing. Great that everyone is awesome. Love it, love it, love it, love it. We got some greats, we got some goods, and we got an okay. But however it is, we're all here standing. So thanks for joining us. Conchasa, I'm going to turn it over to you.
Good morning, everyone, and welcome to session 3 of our virtual online learning community. We welcome you today to learn more about cannabis as STEM. We'll be joined by various medical professionals who will discuss those truths and falsehoods in cannabis. I'd like to introduce you to today's guests. We have Jason Nelson with Cresco. We have Rita McGuire, Dr. Rita McGuire, excuse me, with Wakana. We have Dr. Ashok Shah with Cannaceuticals, as well as Dr. Millard Collier with Cannaceuticals. We have an awesome RN today, Keeber Smith Bolden with Canna Health, and we'll also be joined today by Donald Richard, a pharmacist with Greenleaf Dispensary, as well as Omar and Richard Picante, partners and founders of Greenleaf Dispensary in Louisiana. We thank you. Thank you to our title sponsor, Cresco Labs. Next, we'll have our HBCU Spotlight, provided today by Essentials of Canna, where equity is first. Aaron, thank you. No, we cannot hear you, Aaron. Check your mute and your video button.
Everybody should be live.
While we're waiting for Aaron to come on, today my co-host will be Kevin Ford, one of our partners with Uplift Maryland. Kevin has been an awesome addition to our HBCU Cannabis Equity family, and we thank you today, Kevin, for joining us and helping out.
Absolutely. Thanks for having me.
Okay. Everybody should be able to share the video. Okay. Let's stop sharing. Everybody should be able to make there.
Oh, here we go. While we wait for Aaron, I'll take this time to tell you guys a little bit about Cannavation Analytics, how we got into this space. My business partner and I, we founded Cannavation Analytics about 3 years ago. We saw a need for equity and access for our friends at historically Black colleges, their children that were attending there. And so about 3 years ago, I started fiddling around with recycled products, the stems and leaves of cannabis, and developed a bath care line utilizing THC and additional CBD to target folks that may not want to smoke. So my slogan is, if you don't want to smoke, maybe you want to soak. And so from there, we started connecting with different people at our respective HBCU family institutions. And then from there, we started working with different cannabis companies. And our goal today is to ensure that there's a pipeline built between the cannabis industry and historically Black colleges. We are aware of the power of the 3% of these colleges and universities in the United States that produces over 70 to 80% of our Black judges, our Black doctors, our Black teachers. And so when we look at methods and tools that can help African Americans join this industry, help African Americans be prepared for this industry, and also help the other aspects of our African American community, which includes our older adults, our youth, and other folks that have been impacted disproportionately by the war on drugs. And so we thank you again for joining us today. We hope that you enjoy the show, you learn a lot, and not only just become informed as a potential career person, and in the cannabis industry, but we also want to ensure that you're a knowledgeable and informed voter, because we can't create change without understanding why we need to make that change. So again, thank you to all of my panelists. Thank you, Jason. Thank you, Dr. McGuire. Thank you, Kevin, again, to everyone on here. Thank you, Kibra. Thank you, Dr. Collier. And thank you, Aaron. Would you like to give that spotlight real quick before we get into the panel?
Sure, I can do that. I'll share my screen now. I have a short slideshow. Good morning, everyone. Can you hear me?
Yes, good morning.
Great. So the first one we have is, we're going to be talking about today is Xavier. Xavier is a very special university. Xavier is predominantly Black university, have a very strong science program. The total enrollment, give me 1 second. So there we go. Xavier, we're doing Xavier University of Louisiana and Dillard University. They're both located in New Orleans. So we have lots of culture there, and both organizations are very strong in the sciences, which fits right in with our message today. We'll start with Xavier. Xavier is the only African-American university that is a Roman Catholic school. It has one of the first schools to have a public health master's program. There we go. And has about 3,000 students. It's a co-ed school, and it has a very strong college of pharmacy, about 608 students. Xavier is among the top schools for producing doctors of pharmacy and for bachelor's degrees in the science, especially biomedical sciences and physical sciences. So if you're interested in the STEM, Xavier is definitely one of your top choices as far as attending HBCU. The next school we have is Dillard University. Dillard is a special school because one, it's one of our smallest HBCUs. It's only about 1,250 students, primarily women. But even with it being so small, it has one of the strongest physics programs. Even though it's only a little over 1,000 students, it's number 3 in the country with producing, with producing physics undergraduates. And just something interesting about Dillard, they also have an Institute of Jazz Culture that studies the intersection of community, jazz, and education. So those are 2 HBCU spotlights for this week. Thank you very much. And if you have any questions, please feel free to reach out and we can send you information or put you in touch with somebody at those schools.
Thank you. Thank you so much. I'd just like to start off before I switch over to Kevin, and he'll go through the Q&A and panel section. But I'd like to ask each panelist to give a roadmap. One of the things I've done with youth in my STEM work is ensure that they understand, how did you get there? If it was good, if it was bad, what were those paths, Dr. McGuire, that got you into the cannabis space?
Well, thank you so much for having me, and welcome everyone to this really informative webinar today. I'm Dr. Rita McGuire. I'm an obstetrician gynecologist. Who would ever figure that I'd be in the cannabis space? But 3 years ago, I was actually introduced to the other side of the plant, which is the hemp species of the cannabis plant, and did my due diligence. And I did my due diligence actually because patients, quite honestly, were looking for alternatives to their health. They were looking for something that was organic, holistic, didn't have a lot of side effects. And when I started to do my research on the hemp side of the plant, I was just overwhelmed with the information and the data and the research that shows that this plant, cannabis, has been used medicinally for over 6,000 years. And there's a lot of data that shows that it can assist and improve in symptoms due to chronic illnesses today. So fast forward, I was on the hemp side. I'm also on the marijuana side. In fact, I was the very first physician in Illinois to certify a patient in the OAPP program, the opioid exchange program. We understand the opioid epidemic is at an all-time high. And yes, cannabis is the solution to even our opioid epidemic. So that's how I got into cannabis industry. I'm an advocate. I testified in front of the Judiciary Committee here in Illinois to pass the legalization and taxation of adult use law here in Illinois.
Awesome, thank you. Well, let's keep it in the Chi-Town. Going over to Jason Nelson with Cresco. Jason, you're one of our fan favorites. Everyone enjoys you every week. You're always very informative, and I would love to hear your roadmap. And I don't think you've shared it on any of the shows, but talk to folks about how you started in tobacco and then ended up in cannabis. I think that's cool.
Sure. No, and great to be here, and thanks so much, Dr. Rita, for all the work on the REC program and really long-standing in the program. I've been fortunate in the Illinois program for really 4.5, 5 years, so it's definitely been an interesting maturation. But my personal journey, I have a focus more so in the horticultural plant sciences, as Kinshasa mentioned. Was fortunate, grew up with a green thumb that my parents and grandparents always had an active garden, but I enrolled in an undergrad, was fortunate to go to an undergrad degree at Kansas State University, so top 5 Horton Ag school. But at that time I was still focused on field crops, like Kinshasa mentioned. So not only tobacco, but something like corn, sorghum. That was the majority of my undergrad work. And I figured out 3 years into that I didn't quite have the passion for it. I didn't want to walk cornfields in Western Kansas for any amount of time, let alone the rest of my career. So while I was working through my undergrad, I had a restaurant job, working in a kitchen. And so for a lot of us, that might be your first exposure to cannabis and certainly other drugs in that same context outside of the DARE program that I was raised in through the 1980s and 90s. So began to understand that cannabis could fit more in a lifestyle, possibly less destructive even than alcohol, certainly compared to something like an opioid. And I jumped into the medical cannabis program early. I graduated with my undergrad in 2002, went to Southern California. I basically went, 5 years out there, enjoyed it, but was also scared off by the DEA pressure. There was a lot of raids back then. They would take away equipment. All the workers essentially were going out in handcuffs. So came back, I was in private industry for a while, but then, Denver tried to get legitimate. They were doing a little bit better with more regulation. I also realized I had knowledge gaps, kind of given my initial training. So I went back and did a master's study with a full thesis, research thesis, and teaching assistantship at Kansas State University. And then I let that springboard into my time at Denver. So at 2012 to 2016, 4 years, watching that program go to medical recreational, understanding what commercial production looked like in that environment. And then now bringing that expertise for the last 4 years, not only Illinois, but Cresco has now ballooned out as a multi-state operator. And engagement in southern markets and southern spaces like this is very exciting for us. Not so much that it is kind of the last few states to really build the normalization and the acceptance of cannabis. So again, tickled to be here. And yeah, thank you to you, Kinshasa, and all the panelists today.
Thank you, Jason. So I'm gonna move on over to the DMV, and next I'll introduce Kira. We have something in common. You're a mom like me. So we're both moms of multiples. I heard that you have triplets, I have twins, so.
Yes.
Welcome. You're all in one piece, doing great. So tell us a little bit about how you got into the cannabis space.
Okay, so I am from New Haven, Connecticut. I still live in that area, but I did hear the reference to the DMV. My mom lives in Maryland, and I attended Morgan State, so I do have a real connection to that area. But I started in cannabis kind of unlike like the first two panelists professionally. It happened because my grandmother had an aneurysm, and it devastated her mind and her body. She came to live with me. Now I'm thinking I'm a registered nurse. I got this, it'd be no problem to care for her, but it was extremely challenging due to her brain injury and then the physical effects. It was really hard. So long story short, she came home to live with me. She had therapy in the home, a physical therapist, and they were gonna discharge her because she wasn't participating in therapy. And that's the way it works with Medicare. If you don't show progress, they cut you off. And at this point, she was wheelchair bound, wasn't eating, wasn't really engaging with the family, was aphasic, wasn't able to really express her needs and desires either. And so I was helpless. And one day I was in prayer. And this is why I tell everybody God is definitely in the cannabis industry, because I was in prayer and I prayed and asked God how to help my grandmother. And it came to me that my grandmother had told me maybe like a decade before. Now, this was an 88-year-old vibrant woman who drove, had a boyfriend, all these things. So she was a hip grandma, I will say that. But she had told me like 10 years before that she used to have to smoke a joint and take a bath just to get her body moving due to severe arthritis. So I was like, well, then that's perfect. We'll just get grandma high. I didn't know, the right terms. I grew up in the inner city. We smoke weed, that kind of thing. But I decided, so we get her medicated, and within a month, she's walking with the walker. She's talking, she's engaging with the family. And having been a nurse who primarily did medication administration in patients' homes for like over a decade, I had never seen those type of improvements. So when I saw the turnaround of my grandmother, I said, well, let me take a new look at weed and see what it's about. And then I discovered that it's really cannabis and I went to a program in Massachusetts and learned about the science of the plant, learned about the endocannabinoid system, and I was already, totally engaged because I am a science freak. I love science. But what really struck me and really engaged me in this community was learning about the history of cannabis and the reason why it was made illegal, and that it was primarily racially motivated factors, and how the illegality of cannabis has led to the destruction of many communities, including the community from which I come. And it was just important for me to change that narrative, to be a part of advocating for not only medical cannabis, but adult use cannabis, and making sure that there's equity in that conversation and that it doesn't go forward if there's no equity. And so that was kind of like my start. It definitely was both medical and the social justice aspects of it that really pulled me in. And part of, me, I believe that it's my contribution, one of my contributions to the social justice efforts in cannabis is starting Canna Health, where we help to certify people for medical cannabis. And so that just kind of happened. And, I'm blessed to be serving 6 communities in Connecticut, and I'm currently looking to serve communities outside of Connecticut.
Awesome. Well, I can relate to what you were saying about your grandma. My grandmother lives 2 blocks away, and she'll say, give me one of those sticks. So that means a joint. And she uses my pain cream on her back of her leg, because she's just like, she said, I got 100-year-old bones. And so I can relate to, getting in and seeing how it can help elderly folks, helps with my dad and things like that. So yeah, thank you so much. And then next, let's switch over to Atlanta, to my favorite men of all, Morehouse men. We have Dr. Collier and Dr. Shah here. Thank you guys. It's good to see you again this year. I'll miss seeing you in person this year.
Can you hear me? Okay.
Yeah, I can hear you.
Okay. Thank you so much for having us back again. We're sharing a video camera because Dr. Shah tech was failing on him. So we in the same building. He just came down the hall. So thank you for having us once again. So good to see Dr. McGuire again and some of the other panelists, which we have met previously at other events. So let me tell you, I have been practicing medicine for over 25 years. And in that period of time, I've done sports medicine. I've been the chief ring physician for boxing. I have had occupational medicine and done rehabilitative therapy for people that have been injured. And of course, the primary therapy besides physical therapy has been opioids. And oftentimes the individual, they would be on opioids for some period of time, and the doctor that was taking care of them would just say, oh, you've been on it for 6 months, or you've been on it for a year, or you've been on it for whatever time, and then just cut it off abruptly. And the patients, you know, would suffer tremendously. And the only thing that had changed was that a certain amount of time had gone by, and the prescribing physician was now shy about treating these patients because they, quote, had been on it so long. You know, a lot of discussion in the community now about opioid abuse and, you know, and overprescribing. And I'm sure that that has happened to everybody who can prescribe at some point or another, because there's no pain test. It's just you only go by what the patient tells you. So under those circumstances, though, you're looking for alternatives and things that are better. And what I found, because whenever you prescribe an opioid for a patient, you have to do a drug screen test. And many of those patients were coming back positive for marijuana and cannabinoids. And I was like, okay, they're self-medicating. Now, technically, the DEA says at that point, you're supposed to cut them off, not write any new prescriptions for them or anything like that. That's ridiculous. So what you find that, you know, individuals have been treating themselves in an attempt to find relief. And oftentimes you cannot acupuncture it away, you cannot candle it away, you cannot operate on it. Most of these people have had multiple surgical procedures, and they're either doing worse or not doing it as well as they should. So they're looking for alternatives, and that is one thing that we saw that really made them feel better quicker. So being, I guess you say, one of the initial physicians that would step out and advocate this, because doctors would say, yes, I like to do it, and I recommend it to patients, but I don't want to tell anybody that I'm doing that. They were shy about everything from their professional reputations to being rated by the DEA, I guess you could say, under all those circumstances. So fortunately now, the learning curve has increased across the country, and people are much more accepting of this as a reasonable and real therapy for their patients. And, you know, and so we're in the medical space predominantly, but I have no problems with recreational use if that's what an individual wants to do, because it may just be your emotional well-being. You may just have anxiety, stress. You know, you're as I like to say, you're African-American man or woman living in America. You under stress and catching hell all day, every day. So the objective is that, you know, sometimes you need something that will help benefit you. Dr. Shah?
So my background is a little bit different. I'm a physician, but I'm also an engineer. And my dream was to create next generation medical devices. But when I was going through school, in my undergraduate, I did laboratory research in plant pathology. And my goal was to build these next generation of medical devices, but there were no programs in the late 90s that combined engineering and medicine. It was, you went to be an engineer, you went to be a doctor. So I was a self-taught engineer. And I started an optoelectronics company in medical school that we later sold to Cooper Lighting, and then later Eaton, where I ran R&D for them for 4 or 5 years. And then from there went to Taiwan and was a general manager of the United States for the world's largest LED foundry. So my knowledge base in both the engineering and technology side of how to apply that to any plant, specifically the one of interest that we're talking about is cannabis, but there's over 21,000 medicinal plants that we use every single day in medicine. Everything from colchicine to digitalis, aspirin, I mean, you know, you name it. These are all plant alkaloids. And the ability to now take some technology and apply that on the medicine side, so coming back to medicine after many years of being an engineer gave me a different perspective on ways to apply and use technology. So we're looking at things from novel testing and feedback loops to ways to improve cultivation yields and potentially even create specific compounds that are part of the CBD or THC pathways, and looking at optimizing those yield rates over time using different techniques and different engineering that I've been working on for many, many, many years. And so it's a very interesting way to kind of now look at the problem. And I think Dr. Collier spoke pretty much about the clinical medicine side, so I won't really go into that. But I think Dr. McGuire as well really talked about the opioid epidemic. And I think the thing that really shocked me after having been outside of medicine, when I graduated, we didn't prescribe opioids. It just was not something you did unless you had major surgery. But as those things changed in the healthcare system, I was shocked to see the number of patients that are on opioids just for chronic pain, be it osteoarthritic pain, inflammatory pain, chronic conditions, comorbidities. And the fact that we've had, specifically as alluded to by everybody, these compounds restricted basically for racial reasons versus doing good medicine is ridiculous. It's just ridiculous. And, you know, and now I think if you look at the industry, there was a special on Netflix where they were talking about how hard it is to even get in the industry now, about, you know, people like Anheuser-Busch and Big Pharma and others that are just literally big tobacco, piling up money on the side, waiting for everything to shake out and come in and pick the winners and losers. Now, this is typical of any market, so it's not that this is specific to any market, but, you know, specifically as you look at what's going on today and what we're seeing in the world with regards to change, you know, this is one of those things where social equity has to be a part of this discussion. Criminal justice reform has to be a part of this discussion, and good medicine has to be a part of this discussion. And as Dr. McGuire stated, this is a potential cure to the opioid epidemic. And it's using native cannabinoids that we all have, every single one of us, even those that don't smoke or don't do it. So being able to utilize these along with other medications and making sure that it's formulated properly with your comorbidities, be it diabetes, hypertension, whatever it is that you may have, I think lead for a lot of opportunities in the space and the ability to really revolutionize patient care.
Thank you. Well, our goal with the entire initiative is to revolutionize HBCUs having access to this. We've been working with folks at Morehouse because we see that in addition to having engagement opportunities like this, we need to have educational programs in the institutions. And so we hope to very soon be doing that with some of our partner HBCUs to ensure that they have access to information that you all got outside of medical school. And hopefully we can start bringing that into our undergraduate and our postgraduate programs. So thank you. I appreciate you all being here. And I'll switch over to another Morehouse man, Kevin Ford, and he'll take over the panel from here. Thank you, Kevin. I've got your hat on.
Yes, indeed. Appreciate you having me, and thank you all for joining us today. Just to give a brief synopsis of myself and what I've been doing in the cannabis industry for the past year and a half. I started a company called Uplift Maryland. We're a one-stop shop for pretty much all things for medical cannabis in Maryland. We were awarded a grant to develop and implement a business development and educational program for minorities and women who are looking to apply for licenses. And then we also recently won a second contract to do the dispensary agent training curriculum for Maryland as well. And kind of coming from a medical background, I truly appreciate when I can interact with medical professionals who took that extra step to learn some more about cannabis to truly be able to, you know, provide their patients with the best efficacy possible. So I'll just jump right into it. I get a lot of questions about pregnancy and cannabis use, and even cannabis use while breastfeeding. So I wanted to go to Dr. McGuire first and kind of get your take on the way that you, I guess, inform your patients on their options during that time, even if they do have, you know, extreme nausea or anything like that.
Absolutely. Thank you for that. I've been practicing as an obstetrician gynecologist for 30 years now, and always have practiced in the inner city of Chicago. And 99% of our patients are positive when they come into labor. Their urine drug screen is positive for THC. So our patients are self-medicating. That's why I was very passionate about Illinois passing the adult use law, Because if my patient is going to self-medicate, you best and believe I want my patient to have a product that's not a black market product, a product that could be tainted with so many different harmful chemicals that could not only harm my patient, but the patient unborn fetus as well. So for me, I did my due diligence. There's a very, very exciting study that was done back in the 60s, the late 60s, that looked at about 89 to 90 Jamaican women who smoked marijuana every single day for 9 months. They compared the outcome of fetuses to those women who did not smoke marijuana every day. And what they found were that the motor and cognitive skills of those moms who smoked marijuana were improved. Why does a pregnant mom smoke marijuana or seek to self-medicate? For several reasons: hyperemesis gravidarum, severe nausea and vomiting during pregnancy, depression, anxiety, stress disorders, a lot of medications that are category X that we absolutely don't want to use in pregnancy. And cannabis is a very safe alternative for those moms. There are so many studies that prove that. Now, my college, American College of OB/GYN, of course, they're going to say no to cannabis during pregnancy. But when a mom needs to self-medicate, again, as a physician, I would prefer her to go to a dispensary at least versus getting a product from the black market. And then, of course, there is CBD. You know, there is cannabidiol coming from the hemp species, which is also very, very useful in pregnancy, useful in my gynae patients who have endometriosis, who have dysmenorrhea, very painful menstrual cramps. They can use these products locally, topically. They can use these products instead of using medications, even over-the-counter medications like Motrin and Aleve and ibuprofen, which we know long-term causes kidney failure, acetaminophen, Tylenol causing liver failure. So absolutely, this plant, I advocate its use. There's studies, there's data, there's research, and I feel very comfortable recommending them.
Hey, Kevin.
Yes.
Just really quickly, to add to that, Rita, I've been a recreational smoker and I've also had a medicinal card, but now they're no longer a dispenser. And so I asked my doctor how I could continue to smoke marijuana, you know, while I was breastfeeding. And so he gave me tips similar to tips that you would give someone that's drinking wine. So essentially, he was like, smoke your joint while you're breastfeeding, because, you know, the wine takes a lot of time out. But that was a question I had 14 years ago, and my pediatrician and my obstetrician, they were able to give me information so that I can continue my recreational use, I guess you could say.
Yeah, and we also know that the endogenous cannabinoids that our body produces, 2-AG and anandamide, are found in high amounts in breast milk. So, you know, if you're breastfeeding, you are already exposing your baby to these amazing cannabinoids that our body produces, are endocannabinoids. So, you know, when patients need to be medicated, I would much rather they medicate with a product that's tested, with a product that is not a black market product. And again, you know, we have cannabinoids that are found in breast milk in high levels.
So, and just a real quick follow-up to that, I know Chaucer had mentioned smoking versus, say, using some type of concentrated product like a tincture or some other type of concentrate. What is your thought on, I guess, the difference between smoking or not? And is there a difference when you're looking at pregnancy and breastfeeding?
Well, I prefer, you know, you can actually vape flower, which is a much more healthier way of consuming if you're going to smoke. There's also concentrates, so, you know, dabs that you can use that are more potent. You need less of it. That gives you a less combustible way of consuming the plant. So vaping the plant, having a, I have a vape pen for flower is a really good way of addressing that issue.
Perfect, perfect.
Hopefully I answered your question.
Absolutely, absolutely.
Okay.
So let me shift to Jason here real quick. Being a horticulturalist and really being, with a MSO or multi-state operator, how have you all been able to go about attacking the negative stigma that surrounds cannabis and really trying to debunk some of these myths that are out there surrounding it?
Great question. And that's been a unique challenge. And as a multi-state operator, it definitely manifests itself in different ways in different states. I always thought of kind of certainly Denver on west as legacy cannabis markets, much less stigma that you have to address from a public standpoint. It was more legislative ambivalence and some of those challenges out there. However, coming to the Midwest, understanding a lot of the climate, certainly in the southern corridor there, which is, I think, a more entrenched stigma of cannabis. One thing we do as operators is certainly embrace and exceed regulatory requirements. While that's very expensive from an operating standpoint, we want to give everybody in the public, not only supporters, but detractors, an operational evidence-based approach that says, here's how it can be safely done. Here's how the safeguards can protect either on the production side or the retail side, depending on what the public might be exposed to. And then what that manifests itself as is the regulators become simultaneously your watchdog and an advocate for you as an operation. And we've actually had legislatures from those southern corridor states, Atlanta, Georgia, that got reference from our regulators, came to talk to us about what it looks like, kind of educating themselves. And so that, that helps us be able to establish like Dr. Rita kept mentioning, a standard of quality and safety associated with the operations. And I think that's one of the biggest tools to combat the stigma. Outside of that, I know this group would talk about it handily, would be, more scientifically based research, certainly on medical applications, certainly societal based studies to kind of understand the implications of recreational markets and impact on crime and impact on driving while intoxicated, all the things that our concerns about the space, those to me are really offering legitimacy against the stigma, and the final component really being then diverse and robust social equity investment, because we're working towards that obvious hypocrisy of an operating, profiting company using a substance that was also weaponized against communities of color, Black and brown communities. So I think if operators continue to approach it in that three-phase responsible approach, that's for us been at least one of the most effective tools towards trying to address the stigma.
Excellent, excellent. So, Kibra, we both do medical certifications in our own states, and oftentimes we have patients who come up to us and they say, I want to get prescribed some medical marijuana. Can you just kind of speak to the legality of that term of prescribing marijuana for us?
Okay, so most people don't come to me and say, I want to they say, what do I got to say to get it? And so I'm not sure if you all do it at your certification centers, but we do assess and diagnose people for PTSD. And we're inner city based. So the majority of people who come in are deemed eligible via PTSD. And so, that brings about a whole nother conversation, and it's an opportunity. And I'm sorry, I know it's kind of like going away from your question a little bit, but it becomes an opportunity in our community to kind of point this out to people, because in our community, we've normalized so many traumas that happen every day. And we tend to think that we're fine when realistically we're walking around with unaddressed traumas, self-medicating with things like cannabis, and not really getting to the core of the problem, managing symptoms. And so, that's really, really important for us to do, and for to happen in communities across the country, because now we're enlightening people to why they are unable to keep a job or have healthy relationships, or this is because you've experienced all these traumas, and the symptoms that you are revealing in life are simply directly related to that. And so that's a beautiful aspect. But as far as the legalities, yes, there are very specific requirements in Connecticut and in all medical states. They have to have one of the qualifying diagnoses. They have to adhere to the restrictions of, like, you know, not consuming cannabis and operating a vehicle, not having more than, in Connecticut, it's 2.5 ounces, you know, and being able to transport that, not having it around children, helping people to understand they can't be discriminated against just because of their cannabis use. If it's employment, you know, telling people about the process for being tested as a pre-employee. Like I tell people all the time, if you're a medical patient and you do have your card, that's not something you have to disclose necessarily to your employer. But when you are going for your drug to be tested, make sure that you have a offer of employment first, and that, you know, that you're disclosing that to the testing center, so that, you know, your positive could now be turned into a negative and your employer never has to know. So, you know, there are some things that we go over specifically, you know, how to be a responsible consumer, how to not get, because a lot of times we're helping individuals who are on probation or parole and who are self-medicating or want to use cannabis to address chronic illnesses, including mental health. And they're not able to, because that would be a direct violation. Well, that's not a violation if you are a medical cannabis user. So there are a lot of ways that this can work out to help protect people, but they do have to be aware of what their specific state laws are regarding their use of cannabis and how to stay within legal use.
So one thing that I heard you say earlier in your introduction was really just breaking down the stigma through personal touch, you know, and being able to connect that with somebody's personal story, hearing the story about your grandmother and how that really helped connected you. In your experience trying to break down the stigma in your area, although it is the inner city, but, you know, even in the rural areas that you may go into, how are you able to, you know, use that personal touch to kind of reel people in?
Well, I literally sometimes do touch people inappropriately, I'm sure, you know, but I'll get a salve and, you know, I'll have a older woman with arthritic knee and I'll say, you know, come on, let's put this on. So a lot of it is actually personally, like having the product available for them to just rub on. They get it on their knee, they feel relief, they tell all their friends. And so that's one way to break down the stigma. I go and I speak at churches because, you know, the reality is that, and I know this is about, you know, the medical aspect of cannabis, but there's so much involved, you know, and the reality is before we can get, you know, a 75-year-old woman to be okay with getting a medical cannabis card, we have to unpack and decondition them from all the propaganda that they've heard throughout the years that wasn't true. And then from all the stuff that was true, that people were, their grandchildren, their sons were thrown in prison for this plant. So that they automatically equate it with some sort of illegality and a system that they don't want to be a part of. And so to really educate people about cannabis, about the legalities, about the medical, how it works in the body, why that we already have these things, as Dr. McGuire spoke of, in our endocannabinoid system, and to just really enlighten people. And that's what it's taking. You know, either I gotta rub a little salve on people or, you know, I have to break them down through education.
That I've definitely had the same experience. A couple of my line brothers, they all have bad knees, had to rub it on them a couple times, like, yo, this is it. And then they finally get it, and it's like, where do I get it next? You know, well, now you have to get your card, you know.
And helping them understand they don't have to smoke too.
Exactly.
A lot of people just think the only thing they can do is smoke a joint or have to roll up, like that idea is totally daunting to people. But helping people realize and understand that there are, like we mentioned earlier, tinctures. You can just drop that in your cup of coffee in the morning or your tea in the morning. You know, there are direct topicals. You can make capsules, you know, all of the different ways to just kind of enlighten people to the possibilities really helps to make people more open to to trying cannabis or considering to adding cannabis to a part of their regimen, because these older people, they don't want. One of my first certifiees, I guess, people I certified for medical cannabis was a 94-year-old woman who had broken her hip. She fell, broke her hip, and was afraid to take opioids because of what is true about opioids, what she's seen on television. She didn't want to be addicted, and she knew that it was like almost like a fake relief, and so she wanted to try something plant-based and natural. And that's another way in which we can help people be more open to cannabis, because people don't want the residual effects of opioids, whether it be addiction, whether it be damage to vital organs, so. Right.
So, and one thing I heard you say was openness. And I think that shifting to Dr. Collier, we've seen really a different level of openness among major league sports, and seeing just the acceptance of cannabis use at all these, at pretty much in every sport now. And I just wanted to see if you could kind of touch on your thoughts of that transition and how we got to that, and really more so what you see from the future. And I'll actually talk to Dr. Shah. I heard him say a little bit of what I've been thinking about, just isolating different cannabinoids and then making different combinations. So if you could touch on the sports part first, that would be great.
Okay, am I muted?
No, you're good.
Okay, good. Yeah, so I would say in sports, particularly professional sports, we've taken baby steps. We haven't taken the giant leap yet. The only thing they've done is remove penalties for testing positive in most sports, and they've been slow to adapt. And so, but they still, I think, if you test positive when you have a routine drug, they still have a drug screening program, which means they're looking for something that I don't think is going to be exactly embraced if you test positive. You're just not going to be penalized. So, but again, players are again self-medicating. They have to get through the game. Football, in particular, is hard. The bodies by halftime are suffering, and it's what I call the broken body syndrome. You can't fix it. There's been damage that's just, it's associated with pain. Your body hurts when something is wrong. And so they are doing that. So I think that as time goes on, it's going to be a full embrace. But right now, I'm just glad to see that in this contract, virtually every league now is accepting this and not negative, not kicking people out of the league, and even, reevaluating people that are still or within their playing years that have been kicked out of the league, and not be so heavily penalized. So and working in consulting with the sports leagues and some of the local teams as well, we're giving them the medical education. That's the bottom line, because people they have no idea and clue that some of the topicals will give them more pain relief than smoking. But all they think about when they hear cannabis is somebody lighting up a joint and the stigma that goes with that, and just the bad look. They don't want the leagues to look bad by someone possibly photographing a player with a joint in his hand and smoking actively. But using a topical, a tincture or something like that will give them great relief and give them all the benefits without any of the stigma.
Right. It's interesting that you said that. I actually had a very close friend who was drafted by the Orioles in 2008, straight out of high school. And unfortunately, he didn't get to finish his career because he was put out of the league for cannabis use. Mm-hmm. So that's a topic that touches me personally, so I love to always touch on that. So Dr. Shah, I know you mentioned earlier regarding technology and just the way that we're seeing cannabis going in the future. And I wonder if you could just touch on your thoughts on different concentrated products, and you also talked more so about isolations and different combinations of cannabinoids and terpenes that could help patients find maximum efficacy. So what's your thought or your vision of what you think that is going to look like as we continue to move on over the next couple of years?
Well, I think there's a lot that's up in the air as far as regulation goes, right? I think we've seen this with the CBD industry right now, and specifically we see this in our patient base because there's no quality control, right? You have suppliers all over the United States, multiple different concentrations. The biggest question that patients ask us is, how much of this do I take? How do I use it? And the truth is, we really don't know. And the fundamental issue being that we haven't been allowed to study it. And so as that legislation has opened up and now there are the abilities to get IRBs and to actually search and look at some of these different things, I think it's going to look a lot different. I think the question still remains from a distribution standpoint is how this industry is going to be segmented from the pharmaceutical industry. There are clear lines between the nutraceutical industry, so the supplement industry, the pharmaceutical industry, which are primarily prescription-based and over-the-counter, and where does the cannabis fall? And at this particular point, right, you have states that have dispensary programs and they have a medical card and a path to be able to get treatment. And in other states like Georgia, you can get cards but can't go anywhere to get anything. But with the advent of the Farm Bill, now there's CBD products on every vape and smoke shop and corner gas station that, there's real supply chain issues and quality control issues. I think the Farm Bill moved fast, but it was really loose. And I think that really took a lot of steam away from what the compounds can probably really do if formulated properly, if given properly. But my view is that hopefully one day physicians will be able to incorporate this as an alternative means of therapy, but know how to use it. So that's having the right testing, having the right formulations. That's one of the big questions that, Doc and I joke about all the time is, okay, my mom comes in and she's got all this pain and doesn't want opioids, and I give her a card. Do I tell her just go see Ziggy at the smoke shop? That's not medicine, right? So, being able to refer to specific products, being able to have them formulated, and they could be not just THC or CBD based, but actually have other plant alkaloids and other things that, can have benefits. So I think, just like Kinsasha was doing with her topicals and many other people in the industry, I think that is starting to tease itself out. And, hopefully it'll be integrated in the path of medicine in the next, hopefully as policy changes in the next decade.
Right. And that's one thing that we've even seen in Maryland. We spent all of this session this year and most of last year lobbying in Annapolis to try to get a couple things changed. And one thing that we brought up was education and research licenses. And, even I think Oklahoma instated their research license program, but they still, as of a couple weeks ago, didn't have any registered research licenses. So
well, that's been also an interesting point, because until it's federally legal, right, most state universities and even private institutions won't touch it because they're dependent on federal money. Absolutely. So there's a huge barrier between the money and the policy and the reality of what's going on. And so, if you can't let great scientists and academicians go study it, right, because of risk of getting federal funding, then it's never going to happen.
I would say, like here, I would say for me, being in California where we have recreational, when I go to the dispensary, it's not a pharmacist, it's not a medical professional. When I got my medical marijuana card, I sat on my floor, PayPal $40 to some guy, and he mailed me my medical marijuana card. And I just remember telling him, I got to take my picture like 3 or 4 times. I believe that once things become federally legal, it's going to wipe all of us out. The industry here in the Bay Area is 1% Black. We have predatory folks that are working with folks in these incubation programs. We even have people leading the incubation programs that are, misguiding some of these folks. So I think that right now is very critical for us to be engaged from all aspects. Today, we're focusing on people being engaged from the educational perspective. Last week, we talked a little bit about cannabis to STEM. Next week, we're going to talk about the social equity aspect of it, because we should, as African Americans, demand our space. This should be our industry. This should be part of our reparations, from this industry, but it's hard. It's hard here in California because of the capital. For example, I'm working on my vertical license. I got to pay $200,000 in rent before I even go grab an application. So it's like there's all of these different barriers. And what I've noticed about the South is that the barriers there, it's so obvious that they're trying to keep African Americans out. I feel less empowered when I do my engagement in the South. Opportunities like this, I feel like we've invited some of the politicians and we've invited other folks, even the church members, because we need to break that stigma down. Part of that is this education. Part of our plan was also to develop programs with some of these HBCUs so that a parent, an African American, can feel comfortable sending their child to a Black college, getting a degree in cannabis, because like, who's sending their kids to school, especially Black people? We're not sending our kids to school to go into cannabis, but we need to break that stigma in our communities, in our churches, and in our homes, because we're going to be left out of this industry. And we're like in this mood right now where we're demanding things. We need to demand our space and our place. And I think from our representation on all of our sessions, we show that we've all demanded our space, and we're all also sharing that privilege, because I understand how much privilege has helped me. I've had privilege to be able to get you all on the show, privilege to just be able to get other folks to listen. And so it's all about an exchange. And so I, again, want to thank you all also for being on the show today. I think we're going to switch over to some of the Q&A questions. Tiffany, you want to take that over?
I can do that.
Thank you.
Of course. So we have a couple of questions that have come in. Let's start with the question to Drs. Collier and Shah. I'm pursuing my PharmD, and I'm curious about how opioids affect the body long-term compared to cannabis. Based on what you've witnessed, do you feel that cannabis is a more effective method of treatment long-term? And all of our doctors kind of talked about this, but I think it's something that we can elevate again to the group.
So it's kind of funny because there was a comment I wanted to make when Dr. Collier was speaking about the professional leagues embracing it. And by the way, the NCAA has it. But, you know, one of the comments that we have, and we have a lot of professional athletes that are actually patients, is that they're prescribed opioids for their playing when they play, and they know that they're bad for them. But this is the standard of care and the standard of medicine. And a lot of them, to the point that they were making, are self-medicating because there isn't an alternative, right? So from a clinical standpoint, if you look at pain, right, there's a huge jump. You have the anti-inflammatory or NSAID, so you have aspirin, ibuprofen, Tylenol, and then from there, you have kind of one intermediary, you have the COX-2 inhibitors and all these other ones, and then, but they really don't do that much different, and they're very similar, and the pain relief isn't necessarily that great if you're in tremendous pain. And then you go to a low level opioid like tramadol, and then you go up to actual opiates. And the problem is basically just the way that the opioid system works. I was at a pain management lecture a year ago, and one of the most fascinating things that I learned was really the effects of opioids on T cell function. So long-term chronic opioid use actually does severe immunodepression and leaves patients susceptible to all sorts of other diseases. So, you know, and that's just one aspect of the opioids. But, you know, I think to the question that was there, fundamentally, you know, using an endocannabinoid system, something that we actually make, we do make opioids as well, but something that looks like it's non-invasive, looks like you can't overdose, looks like you can't, you know, have all of these bad outcomes that you get from opioids, make it a very, very viable target. And I think just not that, if you look at what's going on with using MDMA for PTSD, psilocybin for PTSD, I think a lot of these compounds that were just, you know, illegally kind of outlawed in the 60s with the war on drugs are all going to be targets of stuff that we're looking at really using in medicine, and whether it be microdosing or otherwise, that are really going to come to the forefront in the next decade, I would hope.
Thank you. So here's the question, like, to the general group. There's someone in our audience that said, I'm completing a terpene interpreting class, and can anyone speak on the importance of education of terpenes versus THC percentages alone when looking for a specific type of high, right? So in California, when we were able to shift from medicinal to recreational, the kind of boutique brands of cannabis came up, and people were really looking for a very specific kind of high. And that even included in pain management, right? Because people were clear that sometimes their response or reaction wasn't always as good to one type or the other. So what do we think, you guys? That's open to anybody. I saw heads nodding.
So, you know, the data is kind of inconclusive at this point. Again, the ability to study this in depth hasn't been there yet. But there's anecdotal evidence that shows that various terpenes are co-modifying the interaction between the specific cannabinoid compounds and their receptor systems, and therefore can give you some either different euphoric pattern or pain management pattern. That's really kind of the question, and we just don't have an answer yet. And I think that is a great opportunity for someone to help formulate and figure out. And based on some of the stuff that I've seen, I think there is clearly an effect, but we just don't know how and where and how it works. And you know, I think with some of the advanced molecular engineering techniques, and as some of this gets a little bit further down the road, especially legally being able to study, we're going to get to those answers. But to answer the question is, yes, I think it makes a difference. We just don't know what it is yet.
And I could say, you know, I'm not a doctor and haven't done like scientific research, but, you know, I just went to an essential oils farm last summer and I smelled lemon ball, and it immediately like made me feel more awake, more alive, you know. So if you have a cannabis product with limonene in it, it generally has that same effect of alertness, of focus, of refreshing, you know. And so I think when I think of terpenes, I think of the way they work in general in the regular world, you know, something like linalool. If there's something that if I want to sleep, or if I want, you know, I want that lavender, I want that, that's the way in which I look at terpenes. So the effect that I want, I do kind of focus in on the terpene that's involved in the whole cannabinoid profile. And that's what we try to get patients to understand too. You're not just looking for an indica or a sativa or a hybrid. You're looking for not only that breakdown, but what cannabinoids are working. Like, are you trying to get help with sleep? Well, then you need to be looking at a medication, a cannabis medication that has CBG, you know, and those are the types of thoughts and ways in which we can help patients to be very specific. We're lucky in Connecticut that we do have pharmacists in all of our dispensaries, because we have a pharmaceutical model. So every dispensary has to have a pharmacist. So people are able to actually get that scientific and medical instruction every time they purchase cannabis in our state through our medical program. And that is something that our pharmacists are training and showing people how to do, how to look at the menu and find the right profile of everything, terpenes, cannabinoids that will work for them.
And if I could just say one last thing, and I'll be short. Talking about THC percentage versus terpene percentage, most people, as a bud tender, I see people come in, let me get the highest THC percentage you have, you know? And number one, let's take a step back and realize that there's a difference between THCA and THC. You could have a 31% THCA strain with 0.2 THC that is going to have a way different effect than something that's 17% THCA and maybe 1.2 THC. So there are some things there are other aspects to that question that I think that are worth talking about versus just the THC percentage and the terpenes, just as Kibra said, in incorporating the other cannabinoids.
So I was going to go to you, Kevin, but you beat me to it. So I guess a question then for us is, and this is for everybody, like one of the things that we notice, and this is only our third call of 8, that some of the questions where it's clear that people are getting some information around cannabis, but maybe not enough, right? Maybe not as robustly as they could. And so for some of your programs, you both spoke, both Kibra and Kevin, you spoke about how a lot of the conversation you do is really educating folks once they come in the space, right? Like, what is this kind of, what is this experience that you're trying to have, or what are you trying to treat? But also, one of the things that we've seen, especially in California, is that, and with that education came a conversation around advocacy, right? Because now all of a sudden, people were more versed. They were able to have kind of these deeper discussions around why this is the way that we should be going as far as treatment of folks versus the opioid epidemic, and which modeled after the crack epidemic, but is getting a lot more kind of face time and a lot more support because the face of the disease is very different and it's really being treated that way. So I think for us, as we kind of think about this kind of moving forward is, and we had a couple of people that said, like, the last question is, today after the White House review, the FDA released guidelines on cannabis research. I'm saying, honestly, I haven't read this yet. But they asked, how will this impact us? And what will be the first thing we need to study to help push legalization?
I mean, that's the thing. Number one, I have to read it too. I haven't read it yet. But if I could take a wild guess, I think that, I mean, honestly, the guidelines for anything are going to make us relook at the way that we are currently doing anything. And if there is no change into what most people are doing anyways, like as we spoke about earlier, most people aren't doing research right now. So maybe this will push and push docs and to get in there and really start to do some additional research if these guidelines do in fact, you know, open up the walls even more for folks to really get in there and do the research.
Yeah, I do. I just want to add that the research that's currently going on with cannabis is through the University of Mississippi, which we all know the government has availed to that university cannabis that is 20, 30, 40 years old, that's been in a freezer, that they're trying to do research on veterans with PTSD. The other thing is that since the 2018 Farm Bill has been passed, lots of research is being done at UC San Diego with CBD as it relates to autism, multiple sclerosis. So there's a lot of research data that we're going to be seeing since 2018, the next 2 years or more, that's really showing how effective cannabis is in a lot of different disorders.
And I just checked out the link that somebody sent, and what this is they're actually putting out draft guidelines for public comment. So if you do have something that you think that you can add to what they're trying to put out within these guidelines, make sure you submit your public comment so that that can be a part of the discussion.
You're muted. Can't hear you. We can't hear you, Tiff.
I said a whole lot of good stuff, y'all. I'm sorry. I was saying, since we've got about 15 minutes, and I know we're gonna pass over to Jason and Shah, you're gonna take over. For those of you, that link, we'll put that in our reflection activity that we're gonna send out to everybody afterwards. And some of these questions, we had a couple more questions that were in the chat, and we'll see if we can possibly get those included and answered. And if you have something else, keep popping them in the chat and we'll try to pull them out and see if we can respond. Go ahead, Chelsea.
Okay. There was one question that I wanted to ask. It came from my council member, Davila, and she wanted to know if there were any benefits with cannabis in regards to the COVID-19 crisis.
You know, that's an area that's a really touch and go area. You know, COVID-19 is a novel virus. There's just so much we don't know about COVID, but what we do know is that it is a hyper-reactive response to our immune system, that it is an immune system like on steroids going crazy. So there's one thought that because the cannabinoids or the phytocannabinoids from the plant can reduce inflammation, can simmer down the immune system, it could be helpful. There's other studies that shows that the cytokine reaction that occurs in COVID-19 infections can be stimulated by cannabis. So definitely that is something that if you're positive for COVID-19, you don't want to start all of a sudden smoking cannabis, right? You do want to continue medicating if you were pre-COVID. You know, you don't want to stop doing what you were doing. So the studies are still up in the air as it relates to COVID-19 and cannabis. But just know that lots of research is still needed. And if anyone else wants to add to that.
Yeah, well, I was sick in November with what we now think may have been COVID. Lost about 35 pounds, couldn't breathe for a good 2 months. I was on an inhaler. And believe me, I did not smoke. I could not smoke. You know, I took edibles and that helped me because I had a lot of pain in my body, didn't have an appetite, couldn't keep anything in my body. And so I utilized marijuana, the edibles, just for the nausea, just for maybe hopefully gaining an appetite. If you saw me last year, I was about 35 pounds more, you know, larger, but I know that with some of the conditions connected to to COVID, I would definitely recommend that folks take edibles. I have another friend, and so she has a Crohn's disease, She can't smoke because they said it inflames her. So she takes the edibles. So it's all about how the cannabis metabolizes in your body. And so that's just kind of my fake medical tip as a novice, I guess you could say, but a super experienced cannabis consumer. And so thank you guys again. We're going to